Good morning. This is Dr. Bill Wyatt with the American Orthodontic Society, and I wanted to talk a little bit about the use of these Bionators. Back in the 80s and everything, it was real popular, and it was popular among people who did not really understand brackets and bands and things, and using wire to do whatever you needed to do. And it's much surer, and it's much quicker to go ahead and use regular orthodontic appliances. But these were people who did not have brackets and all these things, and so they could use the Bionator to get across certain things. But they're just not capable of doing the perfective work that you need to get done in there. So let me just go through what we did on this young man here. He's a nice young fella, and he came in with this problem where he's got a class 2 malocclusion and an overjet of about 4 or 5, maybe 5 or 6 millimeters, and a closed bite. And so you can take a Bionator and build the thing such that you direct the teeth to erupt in certain places, and it's wearing it is a kind of a pain, and we had trouble, getting somebody to really wear it enough. And a lot of people had nothing but this, and they learned how to do better orthodontics using the Bionator. But let me go through this. We advanced the mandible with the Bionator and held it out there for a while, and now you will see that the teeth actually stay there for a certain length of time, and during that time we straightened the teeth up and got them fitting together in that advanced mandible position. Now here we just changed over the Bionator. Of course, I was used to using brackets and wires and springs and things, and we did that so much easier. So I shifted over in the Bionator into brackets earlier than a lot of people would have. But there's many people that had no brackets or anything else, and were trying to straighten people's teeth out with just using a Bionator. And it helped in some respect, but I don't recommend doing it. Just go ahead and learn how to use the brackets and bands, and you can do a lot better job, a lot quicker, and finish them up real good. You have to wait till your teeth get in the mouth now to get them lined up with the Bionator. You kind of move things around while the tooth was erupting into the mouth. All right, here's before the Bionator. You see we had a overjet here of about, let's see, I need to get my pen going here. We had an overjet here, about 4 or 5 millimeters, and we advanced this out, some of it by leaning the teeth in, and so you bring them out there where you can work with them and open the bite. So here's after we use the Bionator. The teeth are about out at the same height as each other. We're going to close the bite a little bit, and so we just picked up there and put brackets on this young man and finished him up that way. He's age 10. He's got a whole flock of deciduous teeth still in there. We had 2 or 3 other tricks I'll show you. Now, coming in, when you start, you band the tooth like this, and this tooth will come up and catch on the edge of the band. And you need to know a little trick on how to get that tooth out from under that. So here's the band, and both these teeth are going to get caught right underneath here. Well, what you do is come in and put a separator in here, both these places, and just leave it for maybe 4, 5, 6 days even, and then you can come back and take the separator out, and the tooth will move forward some. So we haven't accomplished that yet, so we're going to put the separators in this place right here, and you can watch that come up underneath there better. Let's see. All right, I took the separator out. The tooth was down here. It moved back there. You take the separator out, then the tooth could skip that, and it's going on up here. You open up a space here. In other words, you can take a separator and bring in a lot of impacted teeth. Now when this comes down here, you'll put a separator in that, and tip it back out there, and the tooth will drop in properly. So that's another thing you learn. So here, we took this young man and finished him out with a class 2 correction done like he had, and we went in with class 2 elastics. Now here is the separator. You need to learn how to pop it through, pull it through underneath, and then pull it up. I've got videos on putting these separators and bringing teeth in that actually are down in the gum tissue. And you can pump the separator in there, get them up and move. Maybe use the separator twice to bring the teeth in properly. So I don't advise you to, if you can, get into the brackets and everything. If you can't do it, you can try using Bionators and Herbst appliances and different things like that. But really, the best thing is to get a fixed appliance, and you won't mess with the things other than that. And you can separate it, and then that tooth will come back together, and it won't. You separate it here, and it'll come back together here. And a lot of times, just one separator will bring the tooth in, or you can come in and use it again and straighten the tooth out. So I thank you for watching, and maybe you get something from this. I'm not advocating the use of Bionators, but if you're somewhere you can't possibly use regular braces, then you can help people. And there are people who get pretty skilled at doing nothing but Bionators, but it's not something you'd want to show off as correct as you can get it. Thanks again, and I'm going to sign off here and say bye-bye, and I'll see you back again. I hope you'll join our group and subscribe to it. So we'll say goodbye.